I'm just outside the ambulance service station here in Burnaby. BC paramedics estimate that roughly 75% of all calls coming into ambulance dispatch right now are COVID-19 related. The problem is many people calling 911 are looking for an evaluation and don't actually require emergency care or hospitalization.
We don't want to discourage anybody from calling for help if they truly need it. But we also want to make sure that the public's educated. If they're just unsure or looking for answers or needing guidance, that they call 811, their local physician or their family physician or health officers, and get the information.
It's a tricky situation. While many people may be overreacting due to COVID-19 fears, others are refusing to go to hospital when it's actually recommended they do so.
People are fearful or anxious about going to the hospitals or calling for help for a couple of reasons. They don't want to risk, they're unsure, or they don't want to risk potential exposures or going out, or they're just worried maybe about not being a burden on the system. But, you know, we've been really focusing on getting a message out there. If you're really in emergency or distress, that you need to call 911 or call for help.
A silver lining to this pandemic? Many common emergency calls are actually down as more people work from home and remain in self-isolation. The number of car crashes, falls, assaults, and workplace accidents have dropped as the pandemic continues. The president of Ambulance Paramedics of BC and Emergency Dispatchers of BC says overall, our paramedics are handling a very stressful time very well.
We've always had well-established protocols for personal protection of equipment, PPE. So we have that training and experience. So it's not hard for us to handle these. It just becomes heightened stress when you're dealing with people that are anxious, worried, stressed, fearful, all those things.
In Burnaby, Greg Harper, City News.